و این لایوم نمیتونم که ترنسلیتش کنم، ولی به احتمال خیلی زیاد اگر بندازمش تو یوتیوب اوتو ترنسلیشن میده، چون انگلیسیه احتمالا زیرنویس بتونین ازش بگیرین و امیدوارم که اذیت نشین زیاد در این مورد. ولی من پیش‌فرضمو میذارم که شماها همتون در پروسه مهاجرت هستین و انگلیسیاتون خوبه و مشکل نخواهید داشت. اتفاقا خوبه با یه ذره با دنیای واقعی این ورم آشنا بشید. همه چیز قرار نیست فارسی باشه.
Hey.
Hello. How are you?
I'm great. How are you?
I'm good. Thank you so much. Okay, let's start our live because it's just exactly 1:00. So, hey everyone. Hi. Today I'm delighted to introduce a special guest that I have the honor of meeting her at a gathering at McGill. Khalifa is a registered dietitian here in Canada, and she has accepted to share her experience with us today, which is so special to me, at least. Thank you so much for being here, Khalifa. Thank you. And the floor is yours. Go ahead, introduce yourself, and talk for us.
Sure. I'm so excited to be here. Hi, everybody. And to those tuning in Iran, Rus Behir.
Thank you so much.
a few words in Persian. I'll try to learn some more.
That's so sweet.
I'm really excited to be joining you guys here today. So I'm a mommy of two, and I have been practicing as a registered dietitian for the past 5 years. And recently I have decided to specialize in prenatal nutrition and postpartum nutrition. So what I do is I really try my best to help moms who are looking to elevate their nutrition, their quality of life. And I also really in particular tend to help breastfeeding moms who are struggling with milk supply challenges. So I actually became specialized as a certified breastfeeding specialist, and I use those two hats to help all the postpartum mommies out there. So I really want moms to feel confident that they are giving their babies the best start in life. And so I think back to when I was in your shoes, Shabnam, and I was attending McGill and studying, and I had no idea what my career in nutrition was going to look like. But I could say it's been really, really interesting so far. And so like basically when I graduated, I started working in the hospital, in the healthcare field, and I've been working as a clinical nutritionist for the past 5 years. And I had my babies, and I decided to write a book. So I wrote a children's book that's nutrition themed. Yeah, and it's called Eating These Foods Makes Me. Here, I'll show it to you. That's it. Yeah.
That's so nice.
So, like, all that to say is that you never know where the field of nutrition is going to take you. And, my life experiences have allowed me to branch off and do things that are a little bit outside of the box for a registered dietitian. But it's allowed me to really focus on projects that I'm passionate about, like setting a healthy foundation of nutrition and food at a young age. So that's where my book comes in, and now building out my business. So yeah, there's a lot of different ways you could go when you start off as a registered dietitian, but it's really exciting. So
I have 2 questions so far.
Yeah, go for it.
First of all, what brought you to this specialized, field of nutrition, mothers and, lactating and pregnant women? That's the first question. If you want to answer it now, or I should ask the second one.
Yeah, no, let's do it. So when I studied in my when I did my bachelor's degree and then my master's degree in human nutrition, they really train you to be generalized in all the different areas of nutrition. And I personally found that there really wasn't a lot of focus on maternal health. I maybe had like a course or two towards the end, where we learned a little bit about pediatric nutrition, a little bit about pregnancy nutrition, but there really wasn't much there. And so in order for me to specialize in that, I had to go out and get a certification. And I did that with the Early Life Nutrition Alliance. And I had to study and certify and get trained in that specific field. What inspired me to do that was becoming a mom. So I struggled a lot. I struggled a lot in my first pregnancy. I actually ended up having preeclampsia that suddenly came on. Yeah, it was really shocking because I'm a healthy woman, and there was no risk factors that would make me feel like I would have any kind of issues like that. So it was a big shocker. And what was even more of a shocker was the lack of support. So even though I was struggling in pregnancy with my health, and then even a little bit afterwards with my breastfeeding journey, which was a huge challenge, my doctor never referred me to a nutritionist. And I didn't get that extra support. And I realized then and there that the public health system is doing moms a bit of an injustice because there's a lack of resources and support. So that's why I decided, no, there's really a need for that. And I wanted to use my own experiences, my own struggles, and help other moms so that they would never feel the way how I felt. So that's why I decided to specialize.
That's so inspiring. Thank you.
Yeah.
So, and the second question was about your degrees, because you're a McGillian, and McGill has three ways of, doing your master's. So it's always a question because in Iran, we don't have that system, of being RD. We are, after graduating from bachelor's, we are all RDs. We are all master of all, a jack of all trades, master of none. So that's why I'm asking, just if you can elaborate on that. You took the non-thesis credentialing program, right, at McGill, and it's so interesting to know that what happens after taking that degree, especially for us, because we are spending money, we're spending time, we're coming to another country to study. So that's important to know. If you want to share something here.
Yeah, sure. So it's funny enough, so I'm born and raised here, and I still wasn't clear on the path to becoming a registered dietitian. When I graduated from CJEP and I was looking into what am I going to do in university, and I came across nutrition, I applied to do nutritional biochemistry because I knew sciences were easy to me. Biology I was interested in, chemistry was easy to me, so I figured that would be the great way to go. I thought that after doing that degree, that I would also be a nutritionist. And only I learned when I was attending McGill that that's not the route. That's not the route. So I finished up that degree, and I realized, okay, do I really want to work with people? Do I really want to be a registered dietitian? And the answer was yes. So that's when I made the decision then to do the Master's in Human Nutrition, the credentialing program, because I knew that that would be the route for me to be a registered dietitian. So it was more of a strategic career move, me pursuing my master's. Had I known that, maybe I would have just done my bachelor's in dietetics and saved 4 years of university. But at the same time, I'm glad that I went along that route, because it allowed me to go more in depth into the field of nutrition. And it also gave me a chance to determine if this is really what I want to do. Because as you say, it's a lot of time, it's a lot of effort, and it's money. So it was good in a way that I didn't have to make a hasty decision as to what my career was going to be in that sense.
Okay, so interesting. Do you mean in bachelor's you have also other options? Like, can you elaborate more on that? What other options did you have in your bachelor's?
So when I did my bachelor's degree, I had no idea what I was going to do for work after. Like, I was like, okay, I have this degree in nutrition, in nutritional science, but what am I going to do? I really didn't know. All I knew was that I wanted to work with people. And so I figured then I should become a registered dietitian, because I feel like that's how I'm going to work in healthcare that my goal was always to work in a hospital setting because it was what I was used to. I was already working in the hospital throughout my studies at McGill, so I felt very comfortable in that environment. So for me, it was just kind of like the natural next step to take. And so that's why I decided to do it that way. But I probably could have got a job, you know, if I wasn't a registered dietitian, I maybe would have got a job in industry, maybe in pharmaceutical and, you know, food and beverage companies. Like there's other options out there, but I knew that I wanted to really be doing one-on-one like consultations, helping people, helping patients, whether it was private or not. And so that's why I decided to do the credentialing option.
Interesting. That's really nice. So I have another question. At the end of your master's program, did you pass any exam? Because I know people in Ontario, they have like a multi-step exam. It's a huge one. So I wanted to know if in Quebec it's the same process or it's different.
No, I don't remember having any specific exam that I had to pass. I obviously had to pass all my final exams for my program. And then after that, I was able, and we went through the stage was integrated throughout the credentialing program as well. So we had to complete stage, which is when you're actually getting that kind of hands-on experience working as a registered dietitian. And then after that, it was just to apply with the order. I know some of my peers had to set a French exam because they weren't from Quebec. And so they just had to pass that French exam before they were able then to apply with the Order of Nutritionists and Dietitians of Quebec. But I didn't have that step because I'm born here and I went to high school and yeah.
Oh, okay. Interesting. That was my next question about French. How important is French in this process? So it is important.
Right? It is. And I would say like it is and it isn't. let me explain why. Okay. So in our the order to be, we're under the Order of the Nutritionists and Registered Dietitians of Quebec. And our order always communicates with us in French. It's because of the language laws here in Quebec. So any communications that we get from our professional order is in French. If we're being evaluated and stuff, it's in French. So you have to have a common knowledge of French. Obviously, you need to be able to read and write and understand French well. But in my day-to-day work, I work at an English-speaking hospital for the most part. So when I chart and I document all that in English. And when I'm seeing patients, if they speak to me in English, I speak to them in English. Unless I have a patient who is French, francophone, and is communicating with me in French, then yes, in that situation, I have to communicate with them in French. But and the resources that I provide to them have to be in French. But for the most part, if you're working in an environment that's mostly English, then you're likely not going to have to use French regularly because the population of who you're dealing with is English. And
interesting.
And like so there's that end in the healthcare, but then there's also the other end, which is me and my business. Well, I'm English speaking, so I naturally attract clients who are English speaking. So a lot of the time, I don't end up having to communicate in French in my private practice. Obviously, I have things set in place if I need to, but for the most part, I attract English speaking clients. So I could say I use my French communication skills probably like 30% of the time. It's not the majority of the time. So as long as you have like a generalized understanding of the French language and like people could understand what you're explaining to them, that's really all you need. You don't have to be advanced or like perfectly bilingual, because that's not even the case for me, and I'm born here. So
yeah, that's good to know, right? That's motivation for us, because that multi-step exam that they have in Ontario, it's not easy. It's a lot of time again.
No, I feel like our exams are very like comprehensive, just our exams that we have to go through in our degrees are very comprehensive. And then also there's also the stage layer of things where you're really evaluated on like not just your textbook knowledge, but like how you manage things in the field, right? So like you're evaluated on a whole nother level throughout your stage. If you don't get past your stages, you're not gonna be a dietitian. So like there's lots of levels to how we're evaluated. So I don't think we would need that like extra comprehensive exam in our situation anyways here in Quebec.
Okay, great. So I have my questions here on my laptop. Let's go ahead and ask the second question. Let's talk about your experience working in a hospital because you've been working there for how many years?
5 years, a little over 5 years now.
Whoa, okay.
Yeah.
That's a long time. So can you describe a typical day of an RD working in a hospital in Canada so that we get some insight into it?
Sure.
It's important.
Okay, so first of all, working in the hospital setting is challenging. It's challenging, but it's really fulfilling. So one thing that I could say right off the bat is you have to be someone who likes to learn, because the amount of medical conditions that you're going to come across and like the complexity of cases, there's not a day that goes by, even now after 5 years, that I don't learn something new on the job. So you really have to want to learn, and you have to be ready to go research something and come back with a solution. So in that way, it's challenging because it's not something that's repetitive. Once you know it, you just repeat. Like you're constantly on your toes. So that's what I would say, what it's like working in the hospital. Another thing too is that you're constantly collaborating with somebody. Like you're talking with your patients, you're talking with their family members, you're talking with your other colleagues, your other dietitian colleagues, you're talking with the nurses, the doctors, and everybody else on the medical team. Like it's really an interdisciplinary team when you're working at the hospital. You've got the pharmacists that are involved, and as a nutritionist, what part of what we do, like part of my day at the hospital, is reviewing the charts of my patients. I'm reviewing their charts, I'm reviewing their labs, I'm looking at their medications, and I'm making sure that the food that they're getting isn't interacting with the medications and things like that. So sometimes I have to go and talk with the pharmacist. Sometimes I have to go and talk with the speech language pathologist. In some cases I have, I have patients who, they might be stroke or neurological patients, and I need to assess their oral motor functioning, their swallow, and I do that with the SLP. We go together. So it's a lot of like collaborating and communicating with all the members of the healthcare team, not just your patients or another dietitian. That makes it really interesting and fun because you get to learn things from various areas of medicine. So I would say that's a big part of my day, going and meeting patients, assessing what their nutritional needs are, making modifications based on what they tell me and what's happening in their medical care, and then collaborating with whoever I need to on the healthcare team.
Oh, that's a complicated, part of your job, I think. So, how many patients do you get per day, like normally on average?
Okay, anywhere from 6 to 10, I might end up seeing in a day, and it really depends on what their needs are. Like what I do when I get in the morning, I'll look at all the patients who I am involved with, and I have to prioritize who needs to see me this day. So and it's like new patients coming in are always a priority. So I know I have to do a long assessment with them, because that's when I'm like putting my detective hat on and I'm getting to learn all about them, what's going on in their life. Well, how are they eating? How are they eating before they came in? And what led to this point? So it's a long session for the new patients. And so when I have many new patients in a day, I'm going to see less. But if it's a day where I'm just like doing follow-ups on patients that I'm already involved in, then I could see, 8 to 10 in a day. And that's like really like when I'm on the go. So yeah.
Okay, so do patients come to your room, or you go to their bed, or I don't know, to their settings?
Yeah, so if I'm working on the hospital unit, then I'm going to see them in their room, in their hospital room at their bedside. If I am working in a different setting, because I have worked like in outpatient clinics where the patients are at home, they're living at home, but they're coming and visiting me to help with support in their care. So in a situation like that, they're coming to my office and we're doing one-on-ones. I've also worked in rehabs, and I've worked in residences and places like that. The patients are in between hospital and home. So they're getting extra support that they need to get stronger. Like they're not quite well enough to be on their own at home, and they still need that support. So they're in a rehab or something like that. And in situations like that, I might have to go see them wherever they are. If they're like in the cafeteria, in the dining room, or like do it in between their physio session. Like honestly, it's like wherever you could catch them in those types of settings. So it really depends on like where you're working.
Okay, interesting. And from what I understood, you're not involved in food service management, right?
No, but that is another area, that is another common area that registered dietitians work in. A lot of the times, like I remember when I was studying, it was like, you're either going to work as a clinical nutritionist or you're going to go in food service. I was like, one or the other. And that's not the case. There's so many other like places to work and work in, but yeah, food service is another common one. I'm not involved. I don't work in the cafeteria per se, but there is some communication between the two, because if I come up with a nutrition plan for a patient and I need to call down and to the kitchen to get something, like in a situation like that, I might end up talking with the food service manager. You never know. So there's communication at some times between the two.
And there comes another question. So are you equipped with the knowledge of food service management throughout your master's studies, or you need to learn on yourself by yourself?
That is definitely a part of the master's program. So there's courses on food service, and there's also an element of your stage that you have to complete in food service. So when you do your stage, actually, there are 3 areas. There is clinical, food service management, and community nutrition. So there's 3 areas that you have to go through when you're doing your stage. So.
Can we know more about community nutrition stage? What do they do?
So a lot of the times you're working for like some kind of community organization. So like it might be a charitable organization or a non-for-profit, or you might be working, with the food bank, things like that. Or I'm trying to think of another one. Like there was so many different options. I remember in stage there was like some people who were working with like homeless people. There's people who, some of the dietitians were working for different organizations, whether it was like troubled youth, like different things, anything could be a community organization that has some type of nutrition program happening. And usually when you're doing those types of stuff, you're like looking at policies. You're looking at like, what do they have in place? What regulations do they have in place? What nutrition and food programs do they have in place? Working in schools, like the school boards, what type of nutrition programs do they have in place? Like all that would be like the community aspect.
Okay, you're thinking about a population, like the diets of the population, not individual.
Exactly.
Interesting. That's so versatile. I love that. Okay. And what personal characteristics should an RD have here in Canada?
Ooh, that's a good one. Okay, so oh my gosh, there's like a whole long list. I'm gonna keep it short. But I think that if for anybody who's tuning in and is working on their CVs right now or setting up their cover letters or about to go for an interview, you should jot this down because this is a good one. This is a good question. Okay, empathy, number one, being able to really put yourself in the other person's shoes and understanding like their unique needs, their values, their perspectives, because it's really hard to get someone to trust you if you don't show any empathy. So that's number one. Number two is to have strong communication skills. Like people need to understand what you're telling them and why you're making particular nutrition recommendations. So there's a lot of educating that's involved when you're a registered dietitian. And as I mentioned before, when you're working in a team environment, like you might have an idea for a plan in your mind, but you need to effectively communicate that to your team. They need to understand where you're coming from, why you're doing certain things in this patient's care. So you have to have very strong communication skills, not just verbal, but also written skills. Because a big part of what we do is documenting. We always chart anything that we do in a patient's care, even in private practice in your client's care. You have to have really well detailed charts. So written communication and verbal communication. And then another one is critical thinking, because as you know, Shabnam, in the field of nutrition, things aren't always black and white. A lot of the time when you're working as a registered dietitian, like you're pulling all the pieces of the puzzle together, and the answer is not going to be found in a textbook or in a research paper. You have to make your own clinical judgment. So having good critical thinking skills is going to really help you to be an effective dietitian. And then this one, it goes without saying, but like I said it already, having a passion for continuous learning, because, the field of nutrition is evolving. There's always new, clinical research coming out, new recommendations that are being put forward. So you got to be able to stay up to date with that. And you got to enjoy reading and learning new things. Part of our order requires us to do a certain amount of hours. We have to do 60 hours of continuing education in order to uphold our license as a registered dietitian. We have to do that with a certain period of time. So yeah, continual learning. Yeah, go ahead.
Is it done online? Like that's 60 hours, you said?
Yeah, 60 hours. Sometimes it's online, sometimes it's in person, attending conferences. A lot of it is online, but sometimes you are attending conferences and you are doing things in person. So it's a mixture of both. So yeah. And then the last one, having a passion to serve others. You gotta be a people's person. You gotta really want to serve that person who's in front of you and really understand where they're coming from, what their values are, what their perspectives are, and having respect for others. Like if you're not somebody who likes to work with people, this is not the career for you. Okay, like go be an accountant or get a desk job somewhere, but you need to be a people's person. You need to engage people. Like you got to really have a heart to serve. So that would be probably the most important characteristic.
Yeah, I agree. That's really important. So let's go to our next question. How much an RD makes annually? Sorry for asking this question, but it's really important because I keep receiving messages, direct messages, different places. Like how much does an RD, make annually? Could they afford the cost of living here in Canada, Quebec, or not? So many other questions related to this. So if you are comfortable answering it, we'll be more happy, happier than ever.
Yeah, absolutely. I have no problem answering this question. I think that is that's probably one of the most logical questions to ask is like, if I'm gonna devote my time into this, like, how much am I gonna make? Am I gonna survive? I think that's a good question. So, and it's general knowledge, by the way. Like, you could find this on Statistics Canada, but the average hourly wage is about $40 an hour, and this really ranges depending on like your educational background, how much experience you have, where you're working. So anywhere from 35 all the way up to $70 an hour. So if we calculate that annually, I think the average in Quebec is like $60,000 to $80,000 a year. And that's like for employed dietitians. So that's a very decent salary. You could definitely live comfortably, especially if you're in a household where you have two contributing salaries. You could live a very comfortable life with kids and everything. But but if you go into the business end of things and you go into private practice, well, the sky's the limit there, okay? The sky's the limit there. Most dietitians are charging at least $100 per hour of consultation, and it could be well more than that depending on how specialized they are. And if you run a business, you can make well into the six-figure income. So like it really depends on what avenue of nutrition you go into, where you work, and and how specialized you are, I would say.
Interesting. That's a wide range of salary, right?
It is.
Okay. Yeah. What I'm thinking is that yeah, that's a good deal, I think.
I could say that I'm chiming in about my personal life here, but I think it will speak to something. I decided I want to focus on, raising kids. I want the best of both worlds. Okay, I'm somebody, I want to do everything. Okay, I want to be at home. I want to be a homemaker. I also want to work. Like, I want to be everything. I want to be a businesswoman. I want to do everything. So what I decided was I'm going to work part-time 3 days a week. And I could say like the salary that I make is very comfortable. And it has even allowed me to have like the freedom to, like, for example, I just had my second baby. He's 16 months and I haven't been back to work since. I'm going to go back to work in a little bit, but like it has allowed me to rely on the income that I have made while I was working to be free to spend more time at home with my kids. So like obviously there's a caveat here. It depends on the lifestyle that you live, and it also depends on your financial management skills. but for the most part, the salary is decent, and there's always ways to move up, which is nice. Like some other professions, the salary you make is capped. Like there is no moving up from there. So I like to think of it as, even if you start on the lower end at like $35 an hour, it's like you could always move up, and there's ways to increase your salary from there. So
yeah, that's really what I love about nutrition, because it's flexible, right? You can work online, you can work, at your office, everywhere.
Yeah.
Everywhere you're comfortable. So and I have another question about clinic. If you have your own private practice, how does that work here? Do you need referrals from other doctors, or you can find your own patients? You can do online. How does it look like?
Sure. So, I mean, it's when you start your own private practice, like it really depends on person to person. Sometimes if you're lucky enough to get referrals from doctors, that's great. Well, for most people, that's not the case, because they like, how do you get referrals from doctors unless you're networking, or unless you work in the healthcare field previously, or doctors personally? Like it's not common, but if you do, that's great. A lot of the times it's up to you to generate your own client base. Usually it's through word of mouth or networking, getting out there and telling people about what you do. So that's usually how it works. And I would say that for some people who are lucky, like they start off with a very good client base and they start pulling in money right away. And for others, that's not the case. Like you start off with no clients and then you got to slowly work your way up. And so if that's the case, like that's why for me I decided to do both. Financially speaking, it made more sense for me to continue my 9 to 5 working at the hospital and then build up my business on the side, so that way I'm not like in debt. so that's kind of how it works. And you can do in-person consultations where somebody comes to your office and they see you in person, or you could do virtual appointments. The only thing is when you're giving virtual appointments, there's a certain standard, like a certain level of security of the program that you use. You need to be using a very secure program that will keep all your clients' informations confidential. There can't be any like data breaches or leaks. So like using Skype and Zoom and things like that is not necessarily an option. Like you really have to have a specialized program. So that's if you're doing virtual. But you could do both.
That's interesting. Yeah. Again, it's flexible.
Yeah.
Perfect. Yeah. Okay. I've been receiving some other questions about holistic nutritionists, who they are, what they do. What is the difference between holistic nutrition and dietitian and nutritionist here?
Sure.
Elaborate more on that.
I know it could get really confusing to people because like there's so much stuff we see like on social media, on the internet. Okay, in Quebec, the title nutritionist is a protected title, which means that if I call myself a nutritionist, I am a registered dietitian. A nutritionist is a registered dietitian, whether it's a holistic nutritionist, prenatal nutritionist, which is what I am, like whatever specialized you want to call yourself. Once you say nutritionist, you're a registered dietitian. Outside, like in the States and stuff like that, it gets a little bit more hazy. You have people who are calling themselves holistic nutritionists, but they're not registered dietitians. Who knows? They could have attended a 6-week certification online and call themselves a holistic nutritionist. It doesn't mean that they have the same educational background as a registered dietitian. So I would say, if ever you're not sure, ask, are you a registered dietitian? It's a yes or no answer. And then you're going to know if this holistic nutritionist is in fact a registered dietitian. Now, the term holistic, it just means that you're looking at the person as a whole. You're looking at their mental health, their physical health, maybe their spiritual outlook. You're looking at their social environments. You're looking at all the aspects of their life in order to give your professional advice. So unlike typical or unlike one size fits all nutrition where you're just looking at their medical condition and how they're eating, when you're looking at their holistic nutrition, it's really everything that comes along with that. So like for me, I would say I take a holistic approach to nutrition, because when I meet with my clients, or if I meet with a mom, a pregnant mom, a breastfeeding mom, I'm looking at everything. I'm looking at like, what's her mental state like? What's her body image like? Is she feeling comfortable with her new body after baby? Is she sleeping well? Is she sleep deprived? What's her energy levels like? Is she, facing any restrictive eating, history of restrictive eating? Does she fast for spiritual or religious reasons? Like I really look at everything. And then usually when you're practicing in a holistic way, the way how you intervene is through whole foods and lifestyle modifications. So your goal is to avoid the use of like prescriptive medications as much as possible. You want to focus on how can we modify how we eat and our lifestyle in order to reach our most optimal health. So I hope that kind of clarifies things. Unlike
yeah, it does, but I still have some questions in my head, because previously I had a live with someone in Toronto. She was doing holistic nutritionist, but she still had some steps to do her board exam, if I'm Correct. So yeah, so I don't understand the line between holistic nutrition, because like it's easier to get into that holistic nutritionist in Toronto than compared to an RD, because it's, as I said, it's a multi-step exam for us, immigrants coming from other countries. So it makes more sense to go the direction of holistic nutritionist. But I don't understand the line between these two, because they say what they claim is that we don't prescribe a diet.
Yeah.
We just say recommendations. But I don't understand, like even RDs, they're doing both, right?
Yeah.
They're writing, they're prescribing a diet, and they're explaining it, and they're assessing everything. So what is the difference between, where is that line? And I don't understand. How does it make sense?
Yeah.
Okay,
so as a registered dietitian, I can go the extra length and prescribe someone to eat this amount of proteins. Like if you really break it down into their macronutrients, eat this amount of carbs per day, this percentage of proteins, this percentage of fat. I need you're deficient in iron, and so you need to take an iron supplement. Like I could prescribe these things. I guess for someone who does not have that registered dietitian title, they would not legally be allowed to make recommendations like that. Like they could probably get a lawsuit or something. So I'm assuming that that's probably the line. Then again, I'm not a holistic, I'm not I'm a registered dietitian, so I know what my scope is. I'm not sure what their scope is, but if I had to think of it logically speaking, I would probably say that a registered dietitian is going to be able to do a lot more in terms of interventions with your health and your nutrition. So,
okay.
Yeah.
I see. Now it's
they
clear.
could go a little further. They could go a little bit more advanced. They're looking, as I mentioned before, I'm looking at your blood test, your lab results. Like I'm digging a little bit more deeper, and I don't think that might be the case for the other one who you interviewed. I'm not sure. You would have to ask her, but I would assume that that's the case.
Okay, and are your prescriptions covered by insurance for people?
Yeah. So my consults, I could give they get an invoice or receipt, and they could take that to their insurance and get reimbursed for a percentage of that. Yeah.
I think that's the second difference between these two. You were talking, and another question came to my mind.
Sure.
So sorry for asking so many questions.
Okay.
First,
I do have to go soon, but I'll answer your next question.
Yeah. So what is the challenge of, how do you deal with challenge of cultural difference? Because here in Montreal is a multicultural city. So you get different types of clients with different patterns of eating, with different foods. How do you manage all these differences?
Sure. So I think that goes back to just asking a lot of questions. Like, I don't assume to know the cultural nuances between all my clients. I don't. So I might ask. I spend a lot of time in my first assessment getting an idea of what their habits are, what traditional foods are they eating. And I try my best to make sure that I incorporate those traditional foods or those traditional ways and dishes into the interventions that I provide. I think that's super important. One, because if I suggest a kind of meal plan or a kind of diet that I want someone to follow, not a diet, I don't like that word, but a regime, or like make nutrition recommendations and suggestions that have nothing to do with the way how they're eating, they're never going to follow it. So we're not going to get any results. So it's really, really important to become competent in cultural diversity and things like that. And we do have like some continuing education classes that kind of help bridge that gap. I have attended like some webinars on cultural diversity and competency. It is I remember doing a class like that actually in my degree. It was all about cultural competence. And so there's a certain level, like a certain standard of cultural competence that we have to have as registered dietitians, but that's something that is you constantly learn and improve upon. So like even for me, I work at the Jewish General Hospital. And one thing for me was I didn't know about Jewish food laws when I started. I had to learn that. And so I think being humble and asking questions is the first step. Showing an interest in your patients and your clients' traditional foods and ways of eating, and then actually using those and incorporating that into your recommendations. So it's really about being personalized in your recommendations.
I think. Okay, let's get some questions from the audience. I've got 4. Let's see, what is the first one? Okay, is there limitation of age in hiring as an RD in a hospital?
I mean, other than you just got to be like 18 years old. Like you gotta, there's that, like you have to be legal working age, but no, you could be, there's no limitation. And I think I was reading up on this, like the average age of a dietitian working in the hospital, and it's usually in their 30s and 40s. But like I got hired when I was in my 20s, and I'm probably going to be working there. I mean, you never know, but I have dietitians that are well in their 60s and still working.
Wow.
So yeah, and those are the dietitians that really know what they're talking about, because they've mastered their craft. They've been doing it for years. So those are the really experienced dietitians that you want to look up to. But yeah, there's a big age gap, but there's no, let's say, limitation. Like you're not going to be fired when you turn this age, and you just need to be legal working age in Quebec.
Okay, perfect. Is she paid a fixed salary?
For me, no. I'm paid a fixed hourly wage that slowly increases, but because I work 3 days a week, I'm not paid by salary. I'm paid per hour. If that makes sense. Yeah. And in private practice, I set my own pay. So no, it's definitely not fixed. Like I pay myself what I think I deserve.
Okay. And how many hours does she work?
Yeah.
Do you work?
So a typical workday at the hospital is 8 hours, and you get paid for 7.25 hours. So you're there for the 8 hours, and then you get your break that is not necessarily paid for, but you get paid for 7.25 hours of your day.
Okay, that's so accurate. Thank you. And could you please
LinkedIn?
LinkedIn.
Okay. I'm gonna what I'll do is after the live, in the comments, okay, I'm going to put my I could link to my LinkedIn, and I'll put my website and I guess maybe where you could get my book for anybody who's interested, the website for my book. And so you'll get a lot of those places where you'll be able to learn more about me, reach out to me. The best place, if you have questions for me like directly, is DM me on Instagram, because I'm always on Instagram. Send me a DM and I'll try my best to answer your question like ASAP.
Thank you so much. So normally what I do is that I remove this live videos from my Instagram and then upload it in my YouTube account, but I keep it here, so that people know that your account and they can DM you directly. Yeah, I might do that. Yeah.
It's up to you. I mean, I'll put it in the comments, so it might be there for a little bit, right? Before if you want to remove it, you can. And when you upload it on your YouTube, my information will be there. So you could put it in the description if you want.
Yeah, we can do that.
Yeah.
Okay, perfect. Thank you so much